Right, so in this podcast episode, we have Briea, who is one of our tutors here. And we're just going to kind of take a bit of a dive into Briea's career, what she did during her studies, what she did after her studies. And it's really just to give you guys a bit of a feel of what opportunities you've got out there and how you can take advantage of them. I think particularly those guys who are either presently undergraduate students, you're thinking about becoming an undergraduate student, or you've just graduated from something like physio, sports rehab, sports therapy. This one's going to be for you. Hi, Briea.
Hi.
Hi.
So,
Go ahead. Tell us a bit about you.
okay. So my path into my career and title of BSc Sports Rehab was started interest in college, I'd say. I did BTEC, and it was back when that was sort of a new thing compared to A-levels. I just knew I wanted to go into sports, and I didn't care what it was, just knew I wanted to do sport. So to match up like just sport as an A-level with other A-levels seemed a bit pointless. So went down the BTEC route of Sports Science, and then within that they had a module of massage, and I was like, I love this. They actually even had a self-contained unit of sports massage beds, so it was quite decent with it. Really liked that, liked the injury module, and I thought, right, and that tailored me into with my sport as well. I wanted to help people if they got injured with their sport. Then I thought, well, I'll do my sports massage module and start putting myself out there, ask places to can I come and observe, can I come and shadow?
Yeah.
You're showing your willingness, your keenness with that. And then learn a little bit more before I start my university course. So then I went to university to do sports rehab for 3 years. And on that, in the second year, they had us in their own clinic working on rotation. So we got hands-on pretty soon as we'd done our anatomy. Really liked the massage and the injuries. And from that, you then have a placement in the second year and third year. And they tend to put you in a private practice and a sports team. I, at the time, liked the sports teams, but I knew it was just going to be the unsociable hours. All the players might be off, but you're in with the injured ones. And I liked it for the time I was doing it, but I knew I wanted to be in a warm clinic. Clean. I'm a bit OCD clean, if you've not noticed.
Yeah, I have
Can't
noticed.
do all that mud and all the mess everywhere.
Right.
You know, you've got males in your family that you don't want to be with a full team of males to tidy up around. So, no offence, males. And so then I really liked...
Could I just jump back a little bit?
Yeah. Okay.
So you did your sports massage, you did your first sports massage qual pre-university.
Yes.
Right?
Yes.
So at that point in time, you were doing a BTEC. Were you already thinking about doing some kind of rehab at a degree level? Was that kind of always your thought?
I was looking at physio.
Yeah.
But then I'm not great in hospitals. I don't want to do the hospital rotation.
Yeah.
And just thought I want to do the MSK, so 3 years of full MSK.
Yeah.
And sports rehab was only newly accredited. Sports therapy I looked at, and it wasn't accredited back then. So I thought, am I guaranteed a job after this? So it's weighing up them options as well. Is it recognised where there are jobs for you? So knew I wanted to go into the MSK sports side. So private practice and sports teams was where they pushed you with your placement. So never stepped foot in hospital.
So had you already got some client-facing experience from your college sports massage qual, or was this kind of like an introduction to the sports massage and you weren't able to use it with clients? Yeah,
so they embedded it as a sports massage qual, and then I still wasn't confident enough to set up. You're 16. So I'm not going to start doing clients, renting somewhere. But where actually the clinic was, I shadowed them there, the owner and everything, and it was back then when we had a curtain between us, so we could hear.
Oh yeah.
So I could do a few people that I did know.
Yeah.
So, but he could hear and knew I was safe because I was I was about 17, so I wasn't quite 18.
The dizzy
yet.
heights of a 17-year-old now are getting on, right?
17-year-old treating you like, whew, I mean, for some trust. But then patients then continued to be like my guinea pigs, so to speak, all the way through my university. They were fine. Obviously, they got like cheap massages.
Yeah.
Or can I just practice this new thing I've learned at university?
Okay,
Can I
yeah.
practice this assessment? And they were fine with it because they're getting a cheap treatment
Yeah.
off a student that is learning as they go, and they've been with me ever
Yeah.
since. It's crazy to think that they've just...
Oh, really? All that time?
Yeah.
Oh, right. Wow.
Yeah, I know.
God,
I've
you
not
must-
done anything wrong with them.
Wow.
They're still intact.
I mean, they don't have any limbs anymore, but other than that,
everywhere's been butchered. But yeah, so it's great to find people that are, I think if you're open with them and you're like, I'm a student, you know, there's that level of communication, then they're fine with that. You're just transparent.
So how did you find the difference from doing, say, like a BTEC, which was more theoretical, I'm guessing, with an element of practical in it?
Yes.
Then moving into a degree at a sports rehab degree, which, you know, it's a different setting.
Yeah.
Universities are a different setting to college settings. There's a different expectation on you as well.
Yeah.
And then also there's a step up in the academic and the practical side. So can you think back on how you found that transition?
Yeah, I think BTEC into university wasn't as bad because our tutors were like, look, you either want to be or you don't, and we were already treated like young adults that it's your learning.
Yeah.
Whereas my friends that had done A-level at a different college, they were like, they were still mummied a bit like school, and they were like, they got the mark and they got chased if they weren't there. I was lucky at the university, they didn't have we never set foot in a lecture hall. Our theory was in the clinic rooms that were open with all the plinths.
Okay.
So it was sort of a modern side to it. I never went in a lecture theatre for theory.
And was that the same in sports rehab when you went on to your degree?
That's what I was told. Sorry, sports rehab.
Okay, right. So everything was done in the practical rooms.
Yeah.
Okay, so I get that. So then, I guess that what that's doing is getting you familiar with that practical setting constantly, right? You're always in it.
And I'm a practical learner, so that a lecture theatre, I would have been zoned out. I needed to be hands-on, kinesthetically doing it to learn it. But yeah, I think because I'd done some hands-on before, it wasn't like, oh my God, I'm touching someone and you're there, you know, shorts and sports bras or lads with tops off. And by day one, they were like, can you palpate pubic symphysis on everyone? And we were all like, what? I think just to kill the awkwardness, they're like, boy, girl, palpate pubic symphysis. And we're a bit like startled at first, but then by first year, you're all not bothered, you're all bodies and...
Get it done and dusted, I mean, that was, I'm going back a little bit further back than when Briea, but when I did, just a bit. So when I did my physio training, it was like the same. Day one, you lined up and you were looking at people's postures. So your top was off, and I think it was a great way. I don't think it's done like that now in education. It's been a little while since I've taught like first years at BSc, but I don't think it's done, and certainly not done widespread now in physio degrees, where it's like day one, start looking at each other as an object to be assessed, as opposed to be like some kind of like, you know, sexually or whatever.
Yeah, it's that objective assessment. We call it objective assessment, so objectively.
And you just see people like that, don't you? You see bodies as just as a thing. Oh, is that right? Is that wrong? Or right and wrong is probably the wrong words, but you know, like is there anything I can identify here? So so you had a similar kind of experience. You had that right early on. So when were you starting to feel that actually I can start putting some skills into practice? Because I think you said about in year 2 you started working in a clinic at the uni.
Yeah, so we started working in the clinic. So there'll be the physios that are actually got a client base, but then if they just wanted a massage, then they'd say, oh, we've got student prices with students in here, and the physio was just in the other room. They'd check over our notes that we'd wrote the notes up right. So you've got not just the hands-on skills, but you've got a shift on the reception, you're doing your notes, you're in the clinic. So it's like 2 or 3 of you on at the same time. So you practice each element of it, greeting them in.
Yes.
So you've got from walking through the door to paying and leaving again.
Wow. And you get that experience in year 2?
Yeah, year 2. Yeah.
Right.
So then by year 3, you were like self-sufficient, and when you were on your final placements, then you know you're more appealing to employers. Yeah,
I think this is something that's encouraging to hear as well, is that you touched on that there were some areas that you weren't as comfortable in, maybe, or this is not comfortable, like you just knew it wasn't going to be for you, right? So hospitals were one thing, so you knew that wouldn't be somewhere for you, full stop, because it's not an environment that you would thrive in. And then you also felt like sports teams weren't a great place.
Yeah.
Which is interesting, right? Given that your title's Sports Rehab. Yeah, I think, go on.
I think it tailors to what you like. So I've always done individual sports.
Yeah.
So this team mentality, I like being part of a team.
Yeah.
But
She has to say that because she's part of our team, right? Yeah.
That's self-employed. I liked it, but it was the whole politics side of like what the manager says goes above trumps your medical opinion or for that individual athlete. So I think an individual sport that outsourced to and they're paying clients instead of you're there. It's not the individual athlete paying you for the service. It's just they'll just come to you because they can, because you're there. It's not like they definitely need it as well. So your hours were like ridiculous long because everybody wanted a massage before, everyone after.
Yeah, so there's a few things to unpick here, isn't there? Because I think one is like that club scenario. If you've had a placement, or if you're a student listening to this, watching this and thinking, right, I've had a placement in a sport and environment and it just wasn't for me, there is a different way of looking at it, right? So if you're in a team sport, you're saying like, I guess the pros in that scenario was that you're exposed to a lot of opportunity to put some hands-on skills into practice.
Yeah, there's loads. Full team.
Because there's a team, right? So there's always somebody that needs something doing. And the pros, I guess, the other side is like you're actually in a sport and environment, right? So you're kind of seeing people who are elite or semi-elite wanting to get to the elite level. And so that's a different mentality to see somebody who's walking in off the street who might be passionate about their sport or their activity, but not necessarily at that elite level. Yeah. So the positives of those kind of placements you were seeing, obviously the exposure to that stuff, maybe is how to deal with some of those egos. Was that something that you were kind of presented with?
Yeah, I think not respected as much as you'd hope to be. So I think coming out with this shiny degree or near enough coming out with your shiny degree, because that's like the last summer or something. Right. You want to make them feel comfortable and feel part of the team with them, and you have the banter, have all that. But then at the end of the day, this is my profession, so don't take the mick out of my profession or my title. Yeah. Oh, I've got another groin strain. Yeah, of course you have. All that side of it. And so you have a laugh and a joke about it, but after a bit you're like, just another girl in sport. I think my generation, from ones on the course, there was one of my friends was really into football and she really struggled to get into football because she was a female, because it's just not seen as, it's just not ideal with a male football team, for example, that they're distracted or something like that. So hopefully that taboo has been broken now, and you
definitely see it, aren't you? You're definitely seeing a lot more females in male-dominated sport, which is brilliant, right? Why? Yeah. Just because you're female doesn't make you any less of an ability to do the job, right? And I also think, mind you, culturally, you know, outside of sport and stuff, there's a lot more awareness of what is acceptable behaviour, should we say, you know, so maybe that's part of that as well, you know, like people's boundaries and people maybe not seeing that as always, like there's got to be some kind of sexual relationship between a male and female.
Jokes and stuff.
Right, so that's not seen as acceptable as much,
but
right?
I think it's having that conversation, like I would rather have that conversation, what's your level of banter, what do you know, it's like, what is then over the line for you? What do you take offence to? But then if they're having all different students in, because I think the girl that went in after me reported this particular team. Okay. She didn't feel comfortable, but I think it was such a lads environment. There was no other female staff either anywhere. From youth to head. Wow. To gaffer, and it was like, I got offered a job with them, believe it or not, but I politely declined. I just said I prefer individual sport and just left it at that. Like, you don't need to explain much to them.
So I think what I'm hearing from this, though, is somebody could have had an experience in sport, which was in a club team-based setting, not necessarily enjoyed it for whatever reason. It could be more of those kind of like older views, shall we say, on how they speak to women if it is female. But it may also be some of those elements of, say, the managers and the coaches' input. Could you just explore that one a little bit for us and explain like how you found that maybe to be different to what you were expecting? Or
I think obviously you're a student, so you're wanting to shadow like the head physio, things like that. But what shocked me, or was an eye-opener to me, was that even the head physio, his opinion didn't really matter that much. That whatever the gaffer decided, manager said, goes. So if you're thinking, it's now a big thing now with concussion, we've got a lot more say, especially in rugby. But it was like, no, he needs to come off, and manager's like, he's staying on. And I'm thinking, what's the point? What's the point of us being there you want us when something really bad happens, or we're the ones to blame. But it was like, yeah, a bit of an eye-opener that side, that you can try, and your opinion still, or your professional outlook on it isn't really taken into consideration.
And that dynamic is really, like, having never worked full-time in elite sport, worked with some semi-professional athletes in a team situation, and worked with physio sports rehab therapists who work in professional environments. So that's probably where most of my exposure has been, kind of like as a secondary thing of like training people up who work in those environments. It seems to be that is definitely better than it used to be.
Yes, I
but
agree.
there's still that, because the coach and the manager's job is to get results, right?
Yeah.
That is their thing, right? And their expertise isn't in health. But you can see that in effect, if your head's on the line, if your neck's on the line and you've got to make a decision, you have to believe in your own decision making.
I think there's that fine line of, you want what's best for the club and that's the best player. You think, but then obviously the longevity of that player's career as well. If you think this is going to injure them even further, then at that stage they're just another number as well, and it's just that fast turnover.
Yeah.
Or how long is it going to take for you to fix that? And I thought, well, if they come off, then it would be quicker. But now it's more damage. But.
Well, when you speak to professionals, so I've very recently was speaking to top elite athlete, just in a chance conversation we had, and they kind of understand that they are disposable and that they are I wouldn't say an object, and managers do treat them with respect and what have you, but they do know that they're there to be kind of put on the line. Their bodies are being put on the line for a result, right? To perform on a game. And so I can see that why that tension would arise in somebody who feels very strongly about their professional identity and their professional knowledge being challenged or overlooked based on we want to get the points today, or we want to get a more positive result. So I can see why that would really clash for some people and say, that's just not an environment I want to be in. And
I think it just touches on that moral ground with it of what you would want to treat.
And I don't think what you're saying is that it's immoral. It's just that trying to figure out where that line is and trying to figure out where you're comfortable.
Grey matter.
Yeah. So, again, come back to my point here is that if that is your experience and you haven't had a positive, or you don't feel that was for you, what you were saying is actually you then continued with some sporting type placements and experiences, but not in a team sport, but an individual sport. Is that right?
Well, I still agreed to another, because you could have another one, and I said I'd want a clinic one, but I said, can I try rugby? And rugby was a lot more, completely different outlook with it. And I enjoyed that, but again, I've always done individual sports, so then your hobbies or your interests sort of follow suit. So all my clients after that were like, they're into triathlon, or they're into jiu-jitsu, or whatever random sport I decided to do. You've got that interest with the client, about their sport, and there's that chit chat with them. But I went into one of the clinic placements my final year. I really liked, and they had big contracts, North West Ambulance Service, Greater Manchester Fire. You'd never get into that without a big company. Really enjoyed working for them. I worked for them for 3 years because they offered me a job from placement. So again, I was lucky, somehow stood out on the placement, got stuck in.
Don't know how. I don't know what you're doing.
It was just like, my name is just different. That's why I chose your name. And then, worked for them for 3 years. Alongside building up my own with the athletes that I liked, because it wasn't as much athlete, it was more occupational. Like companies.
So like the fire service, for example.
Yes.
We don't want to talk about them as athletes, but they've got to be fit, right? They've got to be physically fit. So that's kind of like maybe something that you weren't expecting right at the beginning, like pre-decree. You're probably thinking just sport, but actually, surely somebody in the fire service, they need to be fit, right?
Yeah, exactly. And I really liked that. But there was some politics with that of they can only have 3 or 5 sessions because the employers are paying for it. And then by the time you've done your initial assessment for the first appointment, they were half-hour appointments as well. It was like, how much difference am I actually making? And again, it came back to my morals of, is this the clinician I want to be in these half hours? Am I being as hands-on as I want to be? Or is it now getting to a bit of a conveyor belt of tick, tick, tick throughout the day?
Yeah.
And I was like, I want to be more hands-on with it. So they knew I was building up my self-employed.
So this is as a graduate now we're talking, aren't we?
Graduate, I worked for them for 3 years after graduating, gradually building up my own client base. I'd already had back, so I always kept them, and then just gradually with like friends, family, their friends. I never ever did any advertisement. It was all word of mouth.
We'll come on to that bit in a minute, right? Because I want to come back to your university experience.
Okay.
And we're coming back into what you were doing during university that helped you stand out from the crowd, because you kind of tickled around the edges here of saying that you were obviously doing something a bit different to other people because you were getting job offers whilst you were at university. But in previous conversations you've had with me, you've talked about how you worked during university as well.
Yeah.
So what was that?
So I continued the sports massage I did from college and had that throughout uni. So I was still very hands-on, which I think a lot of my peers in my class had never been hands-on before until they were at uni. So I was probably ahead with the sensation, feel of touch, of identifying issues.
Yeah.
But I was also a swimming teacher and a lifeguard, so I had 3 jobs on the go.
Right.
And then, gradually built up into that. But I was also, like, reaching out to people, like, can I come and watch you do pitch side? Like, it's, football is not something I'm that interested in. So can I come and just watch you? Can I come and shadow you? And asking, if you don't ask, you don't get. And if what's the worst you can say? No.
Yeah.
And if not, then remember your weird name that you messaged them in the messages for about 3 times. Borderline harassment. No. But my main takeaway from people is literally connection. I was going on random CPDs where there was consultants in the room, there was years of physios in the room, there's little old me who's not even finished my university degree.
Yeah.
And a lot of them are free as well, and they come with good food. I mean, anywhere there's good food, I will be there at a CPD. I was there and I was like, half the words I didn't understand. I was just smiling away, little name badge on, like, woo, loving this, like, networking.
Yeah.
But people, I didn't see them as someone I couldn't speak to.
Yeah.
Clearly I'm a chatterbox. They probably thought, she's very keen, like, calm down.
She's hiding it very well, isn't she, that she likes to chat?
I remember faces and names, but I'm just interested in people. I just ask them about themselves or what they do.
So there's a couple of things, and I'm pulling out this. And so you did your swimming instructor stuff, but you had a sports massage clinic, which was allowing you to earn a bit of cash as you're going along, refine and hone the skills that you were learning at university.
Yeah.
So that's obviously complementing your university work. So if you were in a scenario where, say, you weren't doing that way of earning money, but you were earning money, say, like working behind a bar, typical student kind of job, although you'd be earning the cash, you wouldn't actually be like consolidating your learning. Whereas doing something in that environment that you hopefully want to get into, there's probably going to be some transferable skills or transferable knowledge into that, applying some of that knowledge back in your clinic and vice versa.
But not even hands-on, it's how client manner, side of the bed.
Sure, yeah.
It's that confidence to speak to anyone from any walk of life.
So then when it really does matter, i.e. when you're a graduate and you need to start earning money, you're already hitting the ground running, aren't you? Because you've got a bit of a client base, you've got the soft skills, as they'll sometimes refer to, as like, how do you get clients? How do you set yourself up? A bed, your equipment. You've got all of that because you were doing it at university, right?
Yeah.
But then the other side of it, you're saying, is that because you were doing that kind of stuff, you were building up a network.
Yes. Yeah. So whether it was ones they put on, a lot of the time they'd be like, they need massage students for Great North Run, for example, or Manchester 10K. And yes, it's volunteer work, but when are you going to get that many athletes all in one place for you? Pre-event, post-event. So you're already getting them hands-on skills in elite sport or general population as well.
And that is something which, you can't underestimate the value of getting those kind of voluntary skills. And I think, again, maybe show me age a little bit here, but this was kind of part of the norm back in the day, back in the early 2000s, where you would just go and get work experience. You wouldn't expect to get paid. You wouldn't expect any kind of remuneration. It was literally just about getting some mileage under your belt, getting your face known, and the willingness and the eagerness to do something like that really impresses people. And I think that maybe this is a bit unfair, but I don't see this so much these days, where people kind of expect, well, if I'm going to do something, I should get remunerated for it.
Yes.
And I'm not saying that people should work for free, but there is something that if I'm an employer, when I was at the university, I would be working directly with employers for when students were just about to graduate, right? And I now teach a lot of employers because they come onto our courses. And so if you're going to present 3 people in front of an employer and you've got one person, they're all kind of be very similar because they've all done a degree and they've all done placements, and you've got one person who's kind of been doing obviously things like CPD, like you were saying. You probably didn't put about the free food on that, right? But you've put your CPD on, right? You were going and doing voluntary events. That just says something about your character. It says something about, that's the kind of person I want to work for me, or I want to work alongside. All of the people that I employ, I'm thinking to myself, could I work with them? Could I just work with them, just me and them in a room, and I can categorically say an absolute yes for everybody? And that's kind of one of my barometers. So automatically you're ahead of a lot of people just because you've went and put yourself in those situations. You might be awful, by the way. You might be terrible sports.
My hands-on skills might be dreadful.
Might be terrible, right?
I can talk the talk.
But like you've shown something that is above and beyond that somebody else is doing.
Yeah, but I've been on the other end of it where at the clinic, then I'd had students reach out to me. I think it was after the pandemic, when people weren't taking them on from pandemic, weren't having another person in the room because the risk of infection, and universities were like overfilled with, they need to get these placements for these students. So they were telling students to go outsource their own. So you'd have students messaging you, and I think, I don't get paid for this. It's more admin. It's someone else in the room that, okay, I'll ask them to type up notes. They do the notes wrong. That's another job to do. Or does my patient want a student doing it? They're paying their own money because it's private for me to do it. Do they want? So it's finding the right one for that. I did have them, and I was willing to help people, but I'm not willing to help people that just turn up when they turn up or tell me when they're going to turn up. I had one person ask if they could come into the clinic on a Sunday between the hours of 12 and 2 for a placement. So it's willingness to learn, but also...
sorry to interrupt. It's not that in itself is a bad thing, right? I don't think like somebody being aware of like what their limitations are or whatever, but being rigid in that and expecting somebody else to... I do not
work on a Sunday. one. But it's...
You do now, by the way, to be fair.
Yeah, I do. Yeah, I do now. Going backwards. I get the time back, don't worry. It's being open to looking keen and saying when works best for you, and like being aware that they are doing you a favour.
Yeah.
So not telling them when you are demanding to come in.
Yeah.
And I think because there's a lack of jobs in the NHS for physios, I think they've got a shiny new degree and they're like, pay me well straight out of university. And unfortunately, there is still a ladder to climb with it.
Yeah, and we see this. I can say this from, I used to head up our physio degree. I was a physio lecturer for a long time. You're trained to a certain level, but you're not the finished article.
Oh, no.
And I think what I would say is the ones who think they are the finished article are the ones that probably need more input.
They're not open to learning. I think I learned more outside of in clinic than you did actually from the syllabus at uni. But that's your starting point.
Yeah, it is. It's your start. It's saying, right, you're ready to go. Now you're ready to go and do more learning. And I would say like the vast majority of new grads I find are eager to learn, and they recognise that they've got more to learn and what have you. So this isn't super. This is like not. I'm still very pro. Like we do a lot of stuff with universities, right? We do a lot of stuff because we think that undergraduate students have got so much to offer, the workforce, the general population. But there are some people who the confused messaging, because I think nowadays what you'll see on things like influencers on Instagram, they'll be saying like, know your worth. And I genuinely think that's a good message to say like, don't undersell yourself. But I think sometimes that self-awareness of where you are right now can be quite difficult. So expecting to be getting paid top dollar straight from university is probably unrealistic, and you're probably going to get unraveled quite quickly, because if you're charging top dollar...
Same as someone that's been in the industry like 10, 20 years.
Yeah. But
I think on placement as well, it's like I get you there to shadow what you want to look at, but then also them soft skills we talked about, how you... they know you've got that qualification, or you graduated. It's on your CV. What else are you showing them? Are you a team player? They might not have a cleaner. I've cleaned toilets. I've filed filing cabinets. And I've made numerous brews. They've hopefully got better. I don't know about the one today. Apologise.
This one's all right, actually. I'm enjoying it.
I'm blaming the water, but It's just getting stuck in and showing that you are a team player. You don't think you're better than anyone, the cleaner, the kit man, anything like that. It's like, how can I help? I'm an extra pair of hands and I'm here to learn. Yes, I don't want all my attention to be making brews. I want to actually be shadowing the physio, but still looking like you're keen in that sense of a team player.
All right. Well, that is the end of our podcast episode. Briea has very kindly given her time to talk through her experiences. As always, guys, please like, comment, share. And I know it kind of is a bit of a cliche. You hear this on the end of load and load of podcasts, but it makes a massive difference. When we're on courses and we're talking to people, we'll bring up the podcast. Oh, yeah, I've been listening to your podcast and all that. Like, we want the feedback, all right? So please, I know it feels like, does it just get lost? It absolutely doesn't. It helps us know if we're doing the right thing. So if this is the kind of thing that is helpful, it's been an enjoyable listen, or you've actually been able to action it, we want to hear from you. But even if not, and you're like, actually, I don't want to be putting any comments in, just whack a like on there. Lush. All right, see you in the next episode.
Bye.